And then we'll rotate people in as needed. Is this thing right? I can't tell. Okay, anyway. Okay, let's get started. Apologize for the delay in getting started. The purpose of today's briefing is to provide the public the latest information about the City of Houston's response to the public health crisis and what we are doing to blunt the progression of COVID-19. We've been asking everyone to practice social distancing, and we have reason to believe that those efforts are working. And I want to thank everyone for your participation, for your cooperation, and we just need to keep it up, and especially in the month of April. But I want to stress the month of April is going to be a very critical time, not just for our city, but quite frankly for our country as well. And you've been hearing that over the weekend. The health experts tell us they expect to see the number of positive cases and sadly even the number of deaths to rise in the next 7 to 10 days. And April is our month to do everything we can to flatten the curve. So we're going to have to be very, very intentional about what we intend to do over the next several days and in the month of April. Let me give you the latest numbers. And again, let me emphasize, I don't like to get caught up on numbers, but it is important for us to provide these numbers to you. Today, the Houston Health Department is reporting 402 positive cases for the city of Houston, and that brings us for a total of 1,145 cases in the city of Houston. Now, let me explain that. In part, that is because we are getting, this is in that 402, and Dr. Purse can elaborate, that's a backlog number. It's not 402 cases from yesterday, 402. 2/3 of those cases back up to mid-March. But we are now just getting the results from a particular lab, and so now they're being factored in today's number. So I want people to know, this is not that all of a sudden, from the testing that was done on yesterday, for example, there are 402 confirmed cases. That's not the case. Just like I believe it was a couple of weeks ago, on a Saturday, our number was at 60-something, and then all of a sudden the number went to 232. That was because of the backlog of cases coming from either LabQuest or the other one was Quest Labs. This one I think is LabQuest. And so these are numbers that stem back, 2/3 of that 402, stem back to mid-March that are just now being calculated. In large part, I think we can say to some degree that these numbers have been factored already into those who have either been notified previously, but now we're just reporting these numbers to you. So that number now is in the city of Houston, total 1,145 cases. And again, as I've said to you before, there are more cases out there. We know there are more cases out there because the testing is not nearly as robust as we would like. Now, on the positive front for today, there are 0 deaths that are being reported in these numbers. 0 deaths. And what does that mean? For the city of Houston, Council Member, Mayor Pro Tem Martin, the total number of deaths in the city of Houston as of today stands at 10. Now, that's 10 too many, okay? But when you compare that to well over the 9,600 people who have lost their lives across the United States in the city of Houston, the total number of deaths stands at 10. 10 of that roughly 9,600 plus. And so that's good news, even though it's 10 too many. And certainly I want to thank all of the doctors, nurses, the healthcare providers, the medical center, and so many others who are just providing stellar care in the city of Houston and beyond. So that's where we are. And in order to keep those numbers from growing even more, again, I'm going to ask people to, as you can see, we all have our masks on, and I'm going to encourage people to put on your mask because you can be asymptomatic, but that doesn't mean that you are you're not spreading it to someone else. So it doesn't have to be, it could be face coverings. You can design yourself. You can customize it to your outfit. This one is colored on the outside blue, matches the blue suit. So that's however you want to do it, But the point is, when you're out working, even in sort of face covering, and that will help to keep people safe as well. We are with the City of Houston employees. In fact, let me just stop right now. Pick back up. Dr. Purse, why don't you come, since I'm talking about the number of cases and
numbers, as the mayor pointed out, is a large increase today, but this is spread over a fairly broad period of time. This is one of the challenges that we have in public health, is that we don't get the reports on a consistent daily basis from the labs that do these. LabCorp is one of the large national labs. It's doing the testing for FEMA, and they're doing thousands and thousands and thousands of tests every day. And it appears that they have sort of collated a bunch of the results and sent it to us all in one bolus. Quest Labs did the same thing, and we are anticipating that they will get better at this, but this is a big burden on them too. This is a lot of work for them, and so while it is frustrating for all of us to see these sudden jumps in the numbers, we need to, like as the mayor pointed out, we need to pay attention to what the numbers mean overall and not in any one specific day's jump. And again, as the mayor pointed out, probably the most important number for today is that there were no deaths reported yesterday. And we are fortunate, if you are somebody who's tracking the numbers, the hospitals are obviously very good at letting us know, and the medical examiners letting us know within a day, or sometimes, and with the hospitals they're letting us know pretty much within a day. And sometimes with the medical examiner's office, they'll have someone that test on that patient will come back several days later, but they're pretty close. So the deaths seem to be a little bit more timely than the lab, but again, just look at the slope of the curve and not the sawtooth pattern it has. So that's about the numbers. Number two, about the masks, I just want to remind everyone, the mask that you wear, the surgical mask that you wear, is not designed to protect you. It's designed to protect the people around you, because there is this phenomenon with this particular virus of asymptomatic spread, which is much more prevalent with this virus than viruses that we have seen over the centuries. Is a very different characteristic of this virus, which has caused it to spread widely. So the mask that you wear does not mean that it's okay to gather in large groups, because the mask that you wear does not protect you. It protects the person next to you in case you are one of those people who is infected and unknowingly infected and spreading the virus. So to that point, the issue of social distancing remains just as important as it always has. And to that point, we have a graphic here that I want to point to, and I can't see it, so I'm going to try to recite the numbers as best I can remember it, and that's fine, is that it shows, so there's a value in public health about infectious diseases. We call it R0, which is a capital R with a small zero. Thank you, Chief. And what it shows, what that is a value of, is a rough estimate of how infectious a pathogen is. And what it really means is, if one infected person were to be exposed, were to enter an environment with 100 other people, how many other people would become infected from that one person entering that environment? The larger the number, the more easily the infection is spread. So with the seasonal flu, it's about 1.1, and we see how much the seasonal flu spreads across the United States. With this virus, it appears to be about 2.4, 2.5, some estimates have it as high as 3. So on this graph, what you're seeing is if one person infected 2.5 people within a 5-day period, and then those 2.5 people over the next 5 days each infected another 2.5 people each, and so on, that at the end of just 30 days, that one person will have infected 406 other individuals. The next line down shows that if that first individual had social distance to the point that instead of infecting 2.5 people, they infected half of that, 1.25. At the end of the 30 days, the number goes from 406 down to 30. And if they social distance even more, and now they infect 0.6 people in a 5-day period, and each one of those social distances as well, the number drops down to less than 3 people. The impact of social distancing cannot be understated. It is vitally important that everybody understand that, and that we wear a mask, and that's what's going to get us through this. Thank you, man.
What's important to me is not necessarily the number of cases, confirmed cases that we're giving to you every day. I am certainly looking at what the death toll is, because regardless of the testing, that gives you some idea of the severity that is hitting our city. So today, our number is at 10, no deaths being reported today. The other numbers that are important to me are the number of people who are reporting to our hospitals, which gives some idea of the ability of our hospitals to meet the need. And based on the information that I've been provided, the charts that I looked at, we are still well within the hospital's ability to handle the load. The other number I look at is the number of people in ICU and the number of ICU beds available. And as of today, that's still within the hospital's ability to handle people who need ICUs. Look at in terms of the people on ventilators, the numbers that's available and numbers that are on the ventilators. And as of today, our hospitals are able to handle that load. Now, so the single objective is to flatten the curve, to slow the progression so that our healthcare delivery system is not overwhelmed. As of today, we are achieving that objective. Ideally, what we are seeking to do is not just to achieve that objective today, but every day in the month of April as we move forward. That's the objective. Regardless of the numbers that we are reporting of confirmed cases, are we slowing it down enough so that our healthcare delivery system can handle the load? And that's what that's our purpose and our objective. And just like Dr. First said, social distancing does work. It does work. And so please govern yourselves accordingly. A total of 68 City of Houston employees, including fire, police, and municipal workers, have also tested positive for COVID-19. That number is 68. 28 are municipal workers, and 19 are firefighters, and 24 police officers. We've also had several first responders in quarantine because